Hello everyone, my name is Malik Arslan and I am going to be the tutor for this course, Biomechanics of Joints and Orthopaedic Implants. So I'll give a brief introduction about myself. So I am currently pursuing my PhD at IIT Kanpur and I am in my fourth year. And basically my department is Department of Mechanical Engineering. So for the coming 8 weeks we'll be having this tutorial session like every Saturday from 4 onwards. So in this session basically I will be solving some sample problems which have been taken from the previous year assignments. So basically I will be solving the previous year assignments which will help you to somebody is in the waiting room. Okay, so which will help you to solve the weekly assignments as well. So and if you need any materials or any other references for this, or you want me to include questions from some other sources, you can give that suggestions. So for today I think we can start with a brief introduction of you guys as well. So can you please introduce yourself one by one, like basically why in which course you are enrolled currently, and like what is your level of education till now, in which year you are studying, etc. Can you go one by one? Mayank, starting from you. Am I audible, guys? Hello? Okay, somebody else. Khushbu? Okay. Am I audible? Can you guys confirm whether I'm audible or not? Okay, you don't have to reply. Okay, fine. Okay, so Sanchita, would you like to introduce yourself? Okay. No, this is the current course you have taken. Like, what in which year? Like, you're pursuing what? Like, bachelor's in. Okay, so you're in biomedical engineering. Okay. And okay, so anyone else wants to introduce themselves? Okay, so how many of you have gone through the weekly lectures and the assignment as well? Have you completed the weekly lectures? Okay, so anyways, I think uh, let's get started. Okay, so is my screen visible? Okay. Okay, so starting from the first question, I want this session to be a little interactive. So if you guys know the answers, you can tell me, okay? So basically this first week it was mainly about the anatomical introduction about the different types of basically first the skeletal system, and then the different types of joints we have in the skeletal system, right? So this is going to be more in the theoretical aspect, okay? So but as we proceed in the course, there will be much more numericals and other kind of problems. But since this week's lectures were surrounded by theoretical aspects of the subject, so the similarly this tutorial is also going to be an MCQ type uh, question in which you just have to answer, okay? So the first question is which of the following works, someone is in the waiting room. Okay, so which one of the following works as an actuator of the limb? So it's the options are given as bone, joints, muscle plus tendon and ligaments. So what do you think is the correct answer for this? You can put your answers in chat box as well. Yeah, so muscle and tendon. So basically you know what an actuator means. So in mechanics, actuator is an element which is used to generate force, right? It produces force or human or motion basically. So in case of humans, there in the musculoskeletal system, we know that muscles are acting as actuators along with the tendons, okay? Muscles basically, muscles and tendons, they transmit load from one bone to another, and the skeletal muscle is an actually producing force. So muscle and tendon is the correct option for this, okay? Is it clear? Now the second question we have here is which of the following attach a skeletal muscle to bone, okay? So the options are tendon, ligament, none of these, all of these. So wow, huh, yeah. Suchita, you were saying something? Yeah, yeah, yeah. So tendon is basically the correct answer, uh, because the muscle to muscle connection is with the help of, sorry, the bone to bone connection is with the help of ligaments, but the muscle to bone connection is with the help of tendons, right? So tendon is the correct answer here. The third question is which of the following is not a function of muscle? Blood cell formation, motion and heat production. Yeah, blood cell formation is the correct option. So can you tell me like this blood cell formation is done by which part, if not by muscle? Yeah, yeah, so it is primarily the function of bone or bone marrow. Specifically the bone marrow is responsible for blood cell formation, okay? So this is not a function of muscle. Motion and heat production are the functions of muscle. Okay, so then we have question 4. So which of the following region in a femur bone consists of hard cortical bone only? Okay, so B. So Mayank, would you wait a minute. Okay, let me just charge it. Okay. Okay, so would you like to explain what this metaphysis, diaphysis and epiphysis means here? Any one of you? Since Mayank you answered first, that's why I'm asking you. Okay, so basically we have let me see if my actually my phone it's a little discharged. basically, the structure of our femur is like this. Okay, I don't have a very good drawing. So basically these end parts, these are known as epiphysis, right? Then the transition region, this portion, it is known as metaphysis, and this middle portion, which is the strongest part of the femur, it is known as diaphysis. And this diaphysis is, since it is in the middle, and so basically you know that in case if you are a mechanical background student, you know that the during the load transfer in a shaft also, the load is coming more at the central part. So this diaphysis is the strongest part, so it mainly consists of hard cortical bone only. Okay, so uh, here also the correct option is diaphysis. Okay, so the next question we have here is, which is the weakest part of the musculoskeletal system? So the correct answer is, which is the weakest part? Okay, B, joints is the correct answer. So you must have the the joints, basically they have multiple functions. They have to provide mobility. Simultaneously they act as connecting points between the two bones, right? And also because of that they have to transfer load from one bone to basically another bone. So these requirements basically make the joints the weaker sides. Okay, because of these functions. Okay, so joints is the correct option here. Now moving ahead, we have, okay, how many types of joints exist in our body based on the structural classification? 3 types. Okay, so can you name them? Can you name the 3 types of joints which are based on? Yeah, and cartilaginous. Okay, so these are the correct options. So basically there are various kinds of classifications we can have. For example, structural classification, and the other you must have studied is functional classification. In case of structural classification, uh, we are there are 3 structural types. One is the fibrous one, another is cartilaginous one, and the synovial joints, right? So can you tell me what is the characteristic of synovial joints, fibrous joint and cartilaginous joint? Any one of you? So basically, in case of synovial joints, we have a fluid filled cavity. Okay, fluid filled cavity within the joint. So this is mostly present in like this joint is present in abundance in the human body. For example, in case of the knee, hip, shoulder, elbow, etc., these joints are synovial joints. Okay, and this type of joint, this synovial joints, it's uh, it allows a relatively larger motion of the basically the bones. Okay, someone is, okay. And then next we have fibrous joints. So uh, like in case of skull sutures, we have these kind of fibrous joints where the bones are connected by the connective fibrous tissue. Okay, and the third type which we mentioned is the cartilaginous joints. So these are examples of where the bones are joined by cartilage. For example, in case of pubic symphysis, etc. And you must remember that while the motion or movement is the most in case of synovial joints, in case of the cartilaginous joints it's the opposite, the movement is minimum. Okay. Okay, so the it is the correct. And the second type of classification which I was talking about is the functional classification. Okay, so do you know what is the functional classification? Basically the type of movement, like whether the joint is movable, it's immovable, or it's partially movable. So accordingly we are classifying it as synarthrosis, epiarthrosis and diarthrosis. Okay, now moving to the next question. Okay, so the shoulder is an example of, it's very simple. What should be the correct answer? Yeah, so shoulder is an example of ball and socket joint. So basically what we have is that the bone here in the shoulder, which is known as the glenohumerus. Okay, so this glenohumeral joint here, it basically it attached the spherical head of the humerus with the shallow glenoid cavity which is present in the shoulder scapula. Okay, so basically we have a shoulder scapula where we have this hollow cavity, then this spherical portion of the humerus is connected here, so it forms a ball and socket joint. Okay. So okay, can anyone tell me what is the degrees of freedom this ball and socket joint have? How many degrees of freedom this ball and socket joint is having? No, degrees of freedom. Do you understand what is the degrees of freedom? Okay, can anyone tell me what is a degree of freedom? Okay, people are still joining the call. Okay, so anyone wants to explain what a degree of freedom is? How many of you are from mechanical background? How many of you are from mechanical background? You can raise your hands, you don't have to necessarily unmute yourself. Okay, somebody is still joining. Okay, so even if you're not from mechanical background, in simple terms, okay, yeah, a degree of freedom means the number of independent motions a body or joint can perform. Okay, so basically in mechanics we define it as independent number of translations and rotations along and like different axes if a body can have. For example, in our elbow, if we are trying to move the elbow about this fixed point, now this is known as flexion and this is known as extension, right? So this motion is 1 degree of freedom. Then we know that another degree of freedom which elbow has is like this, we can move our hand like this. And there is another degree of freedom which is known as basically pronation and supination. Okay, so similarly in case of ball and socket joint we have 3 degrees of motion. Okay, so you can check it also and you can like basically try it yourself as well, that there are 3 degrees of freedom in case of a ball and socket joint. Okay, now let's move to the next question. Question 8. Okay. Yeah, so the question here is, which of the following joints contain fluid filled cavities. So what is the correct answer? C. Can you explain why? See, you can check that these type of classification is basically on basis of function, right? As I mentioned just now also, that it is a functional classification where this synarthrosis means that they are essentially immovable. Amphiarthrosis means that they are slightly movable, okay, and diarthrosis means that the joint is freely movable. Now, how is it related to this fluid filled cavity is that mostly these diarthrosis, because they are freely movable, they are movable because of the synovial fluid and synovial cavity present there. So they, in these kind of joints, due to their functionality, a synovial fluid and synovial joint is also present. So basically, mostly the synovial joints are also the diarthrosis joints. Okay, so these joints are containing the fluid filled cavities. So option C is the correct option. Now, now this synovial fluid, it has many functions. First of all, it's providing lubrication. Okay, we know that in case of our mechanics also, if we have a cycle or for example some car parts, sometimes we are putting that grease or oil into it so that the chain or the parts move freely. Okay, so in the similar way, here in case of joints, it is assisting the lubrication. It reduces friction between the bones, and also it has some other functions like providing cartilage nutrition, etc. Okay, now moving to the next question. Yeah, so the rotator cuff is a group of dash dash in the shoulder. What should be the correct answer? The rotator cuff is a group of dash dash in the shoulder. Okay, A, ligaments. That is not the correct answer. Anyone else can try? Okay, so basically this rotator cuff is a group of muscles. Okay, yeah, muscles is the correct. Can you tell me how many muscles it consists? Anyone? Yeah, it consists of 4 muscles, which you can remember something like SITS, where S stands for supraspinatus, I stands for infraspinatus, T is teres minor, and S is for subcapularis. Okay, so these are the 4 types of muscles which are surrounding the shoulder, and this group is known as the basically rotator cuff. Okay, so these provide basically motion and stability to the shoulder. Now moving ahead. Okay, yeah, so which of the following is not a synovial joint? A, sutures. Okay, so you know where these sutures are present? These kind of muscles are mainly present between the bones of the skull. Okay, and yeah, so these kind of bones are mainly present in the bones of skull, and we just saw in the previous question also that in case of skull there are the there is the basically the least movement required. So these sutures are also a kind of those kinds of joints. So it is not a synovial joint, and obviously in the shoulder, elbow and knee we have these are the main types of synovial joints with the synovial fluid and synovial cavity. Okay, and okay, moving ahead. Okay. So which of the following joints allows pronation and supination? See, okay, I just now also mentioned that in case of the movements of forearm, in which when the radius of the arm rotates relative to the ulna, okay, you can see this is known as pronation and supination. So this kind of motion is present in elbow joint. The shoulder joint and knee joint do not have pronation and supination. Okay. Coming to the next question. The condyloid joint belongs to the class of. What should be the correct answer? The condyloid joint belongs to the class of synarthrosis, amphiarthrosis, or diarthrosis. Can anyone tell me where is this condyloid joint present? Okay, C is the correct answer. So, yeah, in case of wrist, hand, and even feet, between these fingers, between the metapharyngeal joints, okay, these metapharyngeal joints, these are basically a condyloid joint. Okay, so condyloid joint is also known as an ellipsoid joint. So basically, just like the ball and socket, we have an elliptical cavity, and then in that elliptical cavity, the another bone is fitting. Okay, like an oval. Okay, so we have an oval and we have an elliptical cavity. So this condyloid joint, it is also known as ellipsoid joint. Okay, now this is also somewhat similar to the synovial joints, because like it is not exactly an like it is an I don't exactly remember that whether it can be classified in the synovial joint or not, but it is similar. So the if we look at the functionality of this joint, it fits well into the diarthrosis because it provides the complete movement. Okay, so 12 is the correct option. Even I think you can check later on if it is a type of synovial joint. Yeah. So now we have question number 13. So what type of joint is the temporomandibular? So the temporomandibular joint is a joint which is found here in our buccal cavity, like between this jaw and here, somewhere here. This kind of joint is present. So can you tell me what type of joint is this? C, synovial joint. So can you like explain why, Mayank? Yeah, it has a hinge and glide. So basically, you can even check in your buccal cavity also, that when you're opening the mouth, so this will go back, so it acts like a hinge, like this, right? And you can even glide your jaw front. So you can try these motions yourself. So these are the two type of motions this temporomandibular has, and essentially it is a synovial joint. Okay, so the next question is, what is the largest synovial joint in the human body? So one may be tempted to say that it is the hip joint, but actually it is not. Knee joint is the largest synovial joint present in the human body. Okay. Okay, someone is joining. Okay. 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 So at a Gomphosis joint, bone ends are united by, what should be the correct answer? Collagen fibers, cartilage, or dense irregular connective tissue? Um, I think collagenic fiber should be the correct option here. Okay. So because this Gomphosis is a specialized fibrous joint, okay, and its prime example is the tooth in our mouth. So basically the tooth is connected to the surrounding socket which it has with the help of periodontal ligament, right? And that is rich in collagen fibers. So this kind of joint which is present here, which is known as the Gomphosis joint, uh, the bone ends are united by these collagenic fibers. So I think A is the correct option here. Okay, is it clear? Is that clear, Mayank? Okay. So coming to the 16th question. Yeah. So okay, a temporomandibular joint is a, okay, we just discussed it. It is a hinge and gliding joint, right? Yeah. So, it is, I think, already discussed. So, yeah, question number 17. So, which of the following factors influence joint stability? The shape of articular surface, ligaments, tendons. So, I think all these options are correct because the ligaments are also connecting the bones to bones at the joint side. The tendons are connecting the muscle to the bone at the joint side, and uh, the shape of different articular surfaces also determines the joint stability, because we have studied that the better shape articulation between the surfaces, that if they are fitting correctly, the joint stability is more. And even in case of some problems like osteoarthritis, etc., or when the joint axis is misaligned with the uh, surrounding surface, basically the bone axis is slightly misaligned with the another connecting bone, that also creates joint instability. Okay, so these all the three factors are important in case of joint stability. So and yeah, one more point which I would like to say here is that for example, in case of the joint geometry, right, the as I said, that the deep surfaces are more stable than uh, the shallow surfaces. So can anyone give an example where one joint is another, like on the basis of the shape, it is uh, basically more stable than some another joint? You can give examples from the synovial joints itself, which you have studied. A knee, but in comparison with what? See, for example, you can see that our hip joint is more stable than compared to our shoulder joint, right? Why? Because our hip has congruent or like deep articulating surfaces. So because of that shape itself, the hip joint is stable than the shoulder joint. Otherwise, they both are synovial joints, right? But that is one of the factors which can affect the joint stability. Okay. Now question number 8. So the main function of the lumbar spine is, protecting vital organs, bearing the weight of the upper part of body, and holding the rib cage. Yeah, as most of you mentioned, that the lumbar spine, typically from L1 to the L15, they support a large fraction of the upper body, and because of that they bear the weight of the upper body, and it also, basically, this lumbar spine, it contributes to the stability of the spine, okay, and it basically protects the neurons which are present in the spine. So B is the correct option here. Yeah. So dash dash is, yeah, it does hold the rib cage, but see, the question is mentioned that the main function of lumbar spine, if it had been a multiple choice answer, then holding the rib cage would also be correct, but the rib cage, essentially the weight of the rib cage is not alone like holded by this lumbar spine, because there are various muscles in the chest which surround the rib cage, which support it. So it is basically, it does act as a connection between the rib cage, but it does not essentially support the basically rib cage, okay, it does not hold the rib cage. So if you are looking at the main function of lumbar spine, it is bearing the weight of the upper body, okay. I will check it also again, that if holding the rib cage can also be included, because the options are a little bit tricky, but since main function is mentioned, so option B should be correct here. But I will again look into it and I will get back to you in the next session. Yeah. So dash dash is an autoimmune type of disorder. B, right? Rheumatoid arthritis. Okay. So it is an autoinflammatory disease where the immune system attacks the tissues, basically the tissues associated with the joints, okay, they are being attacked by our immune system. It's known as rheumatoid arthritis. Can you tell me what an osteoarthritis and patellar tendinitis is? What is the difference? Like in both of these cases, osteoarthritis and rheumatoid arthritis, they are basically where the joints start to degenerate. But what is the main difference between the two? Can anyone tell? Sorry. See, osteoarthritis, yeah, it is age related, but it's mechanical and degenerative. So in that case, due to aging, due to inflammation, these joints are getting degenerated. But in case of rheumatoid arthritis, it is the immune system which is attacking the joints itself. Oh, people are still joining the meeting. Okay. Okay, so now we have, yeah. So each vertebra has dashed a set of facet joints. Two, right? So we know that in our vertebral column, uh, each vertebra has its superior and inferior articular facet joints, which are also known as zygapophyseal joints, okay. So these joints, basically these are of what nature? These are also synovial joints only, and they connect each vertebra with two other vertebra. Okay, so each vertebra has two sets of facet joints. Okay. Okay, so now this one is the final question of this session. So, which of the following joints can be found on skull? We have already discussed it. It is synarthrosis. Okay, because you can see that in our skull, there is relatively very like these immovable joints. Okay, we can barely feel that there are different bones. It feels like a single structure. Why? Because the bones in our skull are mostly immovable, and the immovable joints are basically known as the synarthrosis joints. So yeah, with that I think we have come to the end of this session. These questions were taken from the old assignments. So have any one of you gone through the new assignment? Have you guys gone through the new assignment? Anyone? Okay, it is fine if you have not gone through or watched the lectures. Okay, let's do one thing. I'll stop sharing my screen. Okay. Let's get okay. So, can you tell me like how many of you have watched the lectures completely? Like you can just raise your hands. Okay, you have watched all the lectures. What about others? Okay, so rest of you have not watched it. Okay, Sanchita. Okay, 3 students have done it. Okay, so it is fine if you have not still watched the lectures. You have another week as well. You can complete the lectures till the end of another week, and try to complete the lectures before you attend the tutorial session, because that would be helpful for you. Now, since you three have completed the lectures, have you already like started doing the assignment? Any of you three? Mayank, Sanchita. Okay, so okay, you have not done it yet, but I think PP Chakrabarti, you have started doing the assignments, right? So like is the new assignment somewhat related to the older assignment? Like, is there some kind of similarity or not? Okay, you can put in the chat box. Okay, few questions are repeated. Okay, so I would like to know from you people that whether this is fine, because we have been, as an the tutor for this course, we have been provided the previous year assignments which we have to solve, and then we have to discuss with you. So I wanted to know that whether you want to include some more questions for some from some different references, or that I can do, or if you're fine with this thing, that is also fine with me. So that is how we will like proceed on with this course. So obviously your feedback will be important for that, and so that I can. Okay, you want to include more questions apart from this, right? Okay, so mostly the session consists of 15 to 20 questions, depending on what kind of questions is are, because this time it was theory based questions, so the number of questions was more, and still there is some time left. But like in future there might be some numerical problems as well, which will be more time consuming. So in that case, the number of questions will be reduced, but I will try to include some more questions apart from the old assignments. Okay, like a couple of more questions, 2 to 3 more questions, which the course instructor has referred to, like any reference books. Okay. So okay, I think with that, uh, I think we can end this session for today. If any of you has something to say, you can unmute yourself or you can put in chat box. Otherwise, if it's okay, then we can end the session for today. Okay, you guys didn't give your introduction yet. So would you like to introduce yourself now? Because I can see many of you. Okay, how many of you are from mechanical engineering background? Because this course is being offered in mechanical engineering, right? Like it's an open course. You can like students from different streams can take it, but the professor who's offering it is from Department of Mechanical. Okay, so you are from mechanical. Anyone else? And how many of you are from biomedical? Like Sanchita is one, and how many others are there? Okay, you're also from biomedical. So all of you are undergraduates only? Okay, Mayank Raj, you're also from biomedical. Okay. Okay, so I see a lot of students are from biomedical. Satyam, Sanchita, Sovik, Mayank. Okay. So you all are undergraduates or some of you are postgraduate students? Okay, those who are UG, please raise your hands. Okay, so PP, you're in a PhD student. So which university? And like, why are you taking this course? Is it like relevant to your research? Okay, so you are in biorobotics. Okay, okay. So I just wanted to know, like, what is the basically distribution of the class, so that I can like accordingly get different type of questions which will be like suited to all of you. So yeah, that's it. I think we can now end the today's session. So thank you very much for attending and have a nice day. Now I end the call.